Hello, my name is Aidan. Today I'll be discussing Parkinson's, what it is, how it affects people, as well as current and future treatments. Parkinson's is a neurodegenerative disease caused by the lack of dopamine-releasing nerve cells in the substantia nigra, a basal ganglia structure located within the midbrain. In the body, dopamine fulfills an important function of carrying information between the brain and nervous systems, helping to control motor functions. As the amount of dopamine is reduced due to damage to these nerve cells, motor functions become hampered, leading to slow and difficult movement. While it is not currently known what causes the loss of dopamine-releasing nerve cells, a combination of genetic and environmental factors is the leading theory. Despite not knowing the cause, several factors have been linked to an increased risk of Parkinson's disease. However, due to the fact that we do not know the root cause, none have been proved to be conclusive. They include family history, exposure to toxins such as used in farming or industrial pollution, head trauma, as well as old age. In America, Parkinson's is the second most common neurodegenerative disease, affecting up to 2 million Americans, the majority of whom are elderly. There are numerous signs and symptoms of Parkinson's which develop slowly over time, with most symptoms not developing until roughly an 80% reduction in dopamine. The symptoms of Parkinson's can include tremors, which mainly occur at rest, slowed or rigid movements, a change in writing patterns, speech, and balance changes, among others. Non-motor related symptoms include behavioral and emotional changes such as apathy, anxiety, amnesia, and dementia. Additionally, people with Parkinson's may experience weight loss, dizziness, and a loss of contrast sensitivity. As Parkinson's progresses, it is generally broken up into 5 stages of severity. In stage 1, generally symptoms do not interfere with daily activities, and commonly tremors occur only on one side of the body. During this stage, it is possible to miss symptoms. Stage 2 includes tremors, rigidity, and other movement symptoms occurring on both sides of the body at an increased level of severity. In stage 3, the most common symptoms include a loss of balance and a slowness in movement. Due to these, falls become more common. However, a person is still able to live independently. However, changes to their daily tasks may need to change. In stage 4, symptoms become limiting to daily activities and an individual's ability to live independently. The major separating factors between stage 3 and 4 is a person's ability to live independently. In stage 5, stiffness in the legs has reached a severity which makes it impossible to stand or walk. The person requires a wheelchair or is bedridden. Around-the-clock nursing care is required for all activities. This is where many non-motor symptoms become common, with 30% of all people with either stage 4 or stage 5 Parkinson's experiencing confusion or hallucination. Next, we're going to talk about some of the current treatments for Parkinson's disease, starting with medications. The first of these medications is levodopa. Levodopa is the most effective drug in controlling Parkinson's symptoms, especially those related to slowness in movement. However, research has shown a link between levodopa and other motor movement complications, leading to disagreements about which stage levodopa should first be administered. To help levodopa, both minimizing its side effects and its effectiveness in controlling Parkinson's symptoms, a number of other drugs can be given. Carbidopa is often given with levodopa as a peripheral dopa deoxyribonuclease inhibitor, as it helps to inhibit peripheral metabolization and allow more levodopa to enter the central nervous system. The next medication which can be given are COMT inhibitors, which are used in conjunction with levodopa as they inhibit COMT, or acetylcholine-methyltransferase, which is an enzyme which deactivates levodopa before it can reach the bloodstream. It is not always given, however, as it has been shown to increase the severity of levodopa side effects. Finally, dopamine agonists can be given early as instead of levodopa to stimulate dopamine receptors. However, they become less effective as someone progresses through the stages. When medication alone is unable to help minimize the Parkinson's symptoms, surgeries may be done, such as deep brain stimulation. Deep brain stimulation is a surgery in which electrodes are placed on the brain and with the help of a neurotransmitter, help control some motor neuron symptoms through creating electrical pulses. Finally, let's talk about future therapies, the first of which is gene therapies, which researchers believe has the ability to both slow Parkinson's progression or reverse the damage it causes. The next of these would be neuroprotective therapies, which would refer to any intervention which delays the death of dopamine-producing cells. The third of these would be biomarkers, which would allow a better monitoring of the disease, as currently the only monitoring is the degradation of motor abilities. The third and final would be neural transplantation, which would be the ability to repair or replace brain cells lost in Parkinson's disease. Thank you for watching this presentation about Parkinson's disease. Hopefully you now better understand the disease.